Hello, I'm Katie Whittigan, the NAPEP Wellness Program Manager, here to give you an annual review of the NAPEP Wellness Program for 2020. We're really here to answer the question, is wellness working? Before we answer this question, let's talk a little bit about why we have a wellness program in the first place. Three main reasons, really. First reason is to improve health, with the hope that improved health will produce improved productivity and attendance of employees. We also want to have a health culture in places of work for improved retention of our employees. And we want to have reduced healthcare costs while also increasing the benefits to employees. When we look at wellness, it's also important to note that it's very few people who do occur a majority of the healthcare costs. So when we provide a wellness program, the more that we can engage those with higher health risk scores, or potentially those with diagnosed diseases like diabetes, the more we can impact the cost to our healthcare plan. As you can see from this table, it is non-participants or those not participating in the wellness program with an above average health risk score who also have diabetes or just above average risk scores that are costing over $1,000 per member per month and making up a majority of that cost. So because we have a wellness program, we try to focus on four main goals each year. One is to measure the improvements of health we're making to our employees. Two is to maintain the health culture within our places of employment. And three, maintain reduced cost to our health plan, because this has been this has been consistent for years. And then to increase participation of the wellness program. So to measure improved health, we look at the biometrics, the risk scores, survey data, preventative screenings, and annual exams. I'm just going to give you highlights of the most significant data in each of these areas to show where we're at in each area. When it comes to biometrics this year, we actually saw a 3% decrease in normal BMI for wellness participants over non-wellness participants. All of this data is from our consultants to our NAPEP benefits group, Siegel, and has been reviewed by actuaries. And this is also coming from a cohort of wellness participants that have been participating in the wellness program for over 3 consecutive years. So it's roughly 750 employees at this point in that cohort. But when we look at change over time over the course of 3 years, we actually saw a 3% decrease in BMI this last year. We also saw a 9% decrease in blood pressure control for wellness participants in this last year. Now, those two numbers going down suggest that COVID has had a large impact on our wellness participant population as well. The risk score is interesting. 74% of our high-risk wellness participants improved their risk score between 2018 to 2020. What that means is a risk score is really created based on how many medications they're on, how many diagnoses they have, how many of their biometrics are out of the normal range, those kinds of measurements. So that's a great sign. It's showing that a large portion of those participating in the wellness program over time do improve. That's notable because there were other non-wellness participating cohorts that did improve their risk score, but at a much less rate, closer to about 60%. So we are seeing an impact by participating in the wellness program. When it comes to survey, we asked 516 respondents whether or not they agreed if the wellness program helped them maintain improvements to their health for 6 months or more, and 68% agreed. However, that's a 3% decrease over last year. So again, not going in the direction that we're hoping for recently. However, when it came to preventative screenings, those participating in the wellness program completed those preventative screenings at a much higher percentage than those not participating in the wellness program, with the exception of the prostate exam. So it's important to note here that if the wellness program were to do only one thing, which is to get people early screenings to prevent costly claims later, it is absolutely doing that. When it comes to annual exams, we actually saw a 13% decrease in annual exams overall. Of course, the assumption on our end is because a lot of doctor offices did close between March and May, which is the months that a majority of our employees do get their annual exams to participate in the wellness program. So when it came to did we meet our goal of improved health, I put a yellow face because it wasn't negative or decreasing numbers across all aspects. However, it was mixed results, and therefore I put a little caution sign there for us to cautiously move forward and pay attention. When it comes to culture, we did see some improvements in this area. 62% of those surveyed agree that they feel encouraged by the direct management to participate in the wellness program. And that is a 1% increase over last year, which is good news. We do know that in just one area, only 45% of the wellness survey participants agree that the direct management participates in the wellness program, which is a 3% decrease over last year. However, 70% of the respondents say that the direct management knows how to positively motivate them, which is a 7% increase over last year. So that's a great sign of kind of a wellness culture going in the right direction. And 82% of those survey respondents agree that my coworkers support my efforts to be healthy. So another 4% increase over last year. And 85% agree that they would recommend their place of work to someone looking for a job, which is a 3% increase over last year. So overall, we got another little caution face, even though there was just one area where we didn't see an increase in the culture when it came to direct management participating in the wellness program. We do overall see a good direction with the culture of wellness, and we want to cautiously move forward and make sure that we try to maintain those gains. So when it comes to maintained reduced cost, we look at medical and prescription per member per month. We look at hospitalizations, and we look at emergency room visits. And what it looks like is that with medical and prescription per member per month for wellness participants is $26 per member per month more than our non-wellness participants. So when we dug in a little deeper, that's definitely very different than what we've seen in the last several years. We found that of wellness participants, only 7% had no claims in 2020, whereas 22% of non-wellness participants had no claims. And the thing to remember about no claims is that it's kind of a wild card. No claims doesn't necessarily mean healthy. It could mean a simmering issue under the service that hasn't had attention. So while non-participants also have lower risk scores and use the healthcare less frequently, that does not mean they're healthier. It is possible that many of the non-participants have health conditions that need attention and avoid the healthcare system, and so therefore could lead to more severe events and costly events in the future. When it came to hospitalizations, we found that with our cohort of participants in the wellness program, their admission rate was 9 more hospital admits per 1,000 than our non-participants. So we actually saw more hospital admits for the wellness participants this year, which is also a new phenomenon this year. We did see, however, with emergency room visits that there were 77 less ER visits per 1,000 for wellness participants than non-wellness participants. So that is an indication that those participating in the wellness program are at least utilizing the health plan appropriately, more so than potentially those not participating in the wellness program. So again, overall, we have a caution sign here. We did see no reduction in cost for the cohort or even higher hospitalizations for the participants, but a much lower utilization in the emergency room, which is a high cost item. So again, cautiously moving forward in this area in the next year. When it came to participation, we did see a 3% decrease in participation over last year, with a total of 49% participation this year. So this is actually new for the last several years as well. We had been seeing a steady increase in participation over the last few years. We assume that had a lot to do with the impact of COVID, but it's interesting to break it out by agency and note that there were a few agencies that actually saw a slight increase in participation. One of those was the Accommodation School District, and the other was the Flagstaff Unified School District. And Mountain Line was pretty close to the same. The thing to note about that is that when I spoke to school district employees, they said because they weren't in class and they weren't wrapping up the end of the school year, that they actually felt like they had more time to participate and do the services, and therefore actually felt good about reporting their participation. So when it comes to participation, another interesting point is that 69% of wellness participants visited Vera and 51% of non-wellness participants visited Vera. I point this out because there is bleed over, right? Even if someone's not participating in the wellness program, it doesn't mean they're not doing things for their wellness, which is actually the point of trying to create a wellness culture, that you're impacting all the employees, not just the ones that are reporting their participation into the program and receiving rewards. So it does highlight that just comparing wellness participants to non-wellness participants may be no longer a methodology we want to use in the future as we try to measure the wellness program, because even non-participants are actually utilizing some of our wellness services. So when it comes to change goals as far as increasing participation, we did get a red face on that one because we did not meet that goal in all areas. When it comes to recommendations for the future, when meeting with leadership of various agencies, these were the major recommendations. Increasing marketing for one-on-one services for large behavior change impact. We have a lot of one-on-one services available for employees, so we're going to increase marketing for those. Sending leadership quarterly communications, updating them on the wellness program and how they can show support and increase services to employees. Providing one-on-one wellness guidance for employees, so making our wellness team more accessible to employees so that we can guide them directly to the resources they need. And marketing medical benefits that help reduce costs, like telehealth and our employee assistance program. So if you have any questions regarding the annual wellness review, please call the wellness office at 928-679-7176. And thank you so much for listening.